So the way it works is I'll spend 16 months on the island doing all the didactic and the basic clinical skills, you know, cadaver dissection and all that kind of stuff. And then I'll spend 2 years back in the US doing all my clinical rotations at teaching hospitals. So I pick like an area. I can try to make arrangements. There's none in Arizona specifically. I can try to make arrangements and like do it at Maricopa. I've known several students that went to the school that have done that. Or I could take advantage of the situation that I'm out and about traveling already and pick like Boston or New York or Florida or California and do one of those things too. So anyways, you spend total, you know, it's total med school is a total of 4 years to get your MD, and then I'll have to go to residency.
Very nice.
You specializing?
I want to specialize in critical care pulmonology. Yeah. So excited. So yes, I will not be back next semester. So for those of you who don't like me, congratulations. And for those of you that do like me, I'm sorry.
Does this mean we have a test today?
No. This means that I have, you know, I've had a couple like, what do you mean people don't like you? I always think that people like me until I get my,
Your reviews.
the evaluations at the end of the year. Everybody, and like, I had one last year. What did you like about this class? And somebody put on there, nothing. What did you like about the instructor? Nothing. But I have an idea who I know who that was because I flunked her. But they don't. They really are.
She flunked herself.
She flunked herself. Honestly, she never.
Did nothing.
She really did nothing. But I'm always surprised. I'm always like, gosh, man, I've been over backwards for these kids. But yeah, I only had a couple that were. Oh, really? But anyways, it's not a popularity contest. And people learn, so that's all that matters. As long as you guys learn something. So it's not like I'm going to any frat parties with you guys or anything. And get invited. I'm sorry. I just wanted to go, I swear. I just want to be popular.
You want to be invited?
Yeah. Anyways, so questions on the homework.
I'm still lost with like chapter 19 and 20.
Okay, 19 and 20. Give me an
Same
example
here.
and then I'll do it.
I don't know, maybe just like one of the label ones. I don't know what these
Do one of the ones.
Yeah.
Does anybody have the? Do it some off the homework?
Like off, directly off web study.
Let me do that.
Because some of those were pretty dirty.
What's that?
Like the homework wasn't like that, but then the exam, there was stuff on there that wasn't even on the homework.
Let's look at that.
Fill in the blank, how much liquid or how much powder was in it.
Yeah, I got like an E.
All that
I got
was-
like an E on one of those, and I was like, what might I do here?
I will pull up the web study.
This is scary.
No, this part is confusing to me. Anything else is fine. It's just this part.
CML.
And then I was.
Alright, let me see here. So you said the exam was the problem?
Both.
Yeah, it was probably a picture of both, but I think it was the exam.
Let's look at.
I knew everything before that chapter, and I got 21 students, 19 students, I don't know.
Alright. I'll do some of the ones that were very commonly missed. Here's one. problem is I can't go into a test without showing them. Let's see here.
What's the hardest test they've taken? So bad. What's the hardest one?
So bad. I know.
Maybe I can get it to pull up the top, showing some of these people's grades. Okay.
On the screen.
Oh, my neck hurts. This is what I opens. On the fly here.
She just answered questions. They're tricky.
Okay. Now here's the test. Let's see if there's one specific that everybody missed. I think almost everybody missed it. Where's it at? Let's give me a totally different dip.
Penicillin, your child weighed right there. Maybe.
It didn't show me, it's not giving me the one that I wanted to do it on the thing anyway. Okay, so let's do some of them. Okay. Sliding scale. We know sliding scale is all you have to do is look at the patient's glucose. 364, right? So what is between 364?
301.
301 to 400, right?
So 6 units.
So 6 units. So I don't need to worry much about that, right?
Right.
That's an easy one. Okay, here we go. Solumedrol, 62.5 milligrams per ml. How many milliliters must be prepared? Okay, this is the 1928 test. This is one version of it. I have a ton of there in the test bank, so every time that you click submit, it should be a different set of questions. Okay, so that's why some of these I've never seen before in your guys' tests. But 62.5 milligrams per ml. What do I need to do?
Like a ratio and proportion kind of thing.
Get this switch quickly. Okay, so I want 375 milligrams. What was available?
62 and a half
62.5 milligrams
per 1
per
ml.
1 ml. Cross 375 times 1 divided by 62.5 milligrams. Okay, so then I take my calculator, 375 divided by, and it's 6 mLs.
Yep.
62.5. Okay, since I cross these out, what's my unit left? Okay, 6 mLs. Easy peasy lemon squeezy, let's keep going. Do we have a question on 1.3 here?
You just did the same thing,
Yeah,
right?
same thing.
Pretty same exact math. Okay. What about this one?
It's the same thing, right?
Same exact math, right? Here's one that's a little more complicated.
Yeah.
Let's do this one. 1 gram vial of medication power at 0.4 mLs volume. Like I talked, right? You know what I'm trying to say. and how many milliliters diluent needed to be added to have a final concentration of 50 milligrams per ml. Okay? So let's do this. Let me write down the numbers first. 1 gram vial, 0.4 ml volume. I want 50 milligrams per ml. Correct? Okay, so I have a 1 gram vial at 0.4 mLs in volume. I want a 50 milligram per ml concentration. Okay, so this is how I can do it. There's two ways to do it. I can do ratio and proportion, or I can do it dimensional analysis. Dimensional analysis, I would do this. Oh,
No.
I missed one step. What step did I miss?
Yeah, figure a gram.
Good answer. The only thing left is mLs. So 1,000 divided by 50 is, let's do that. That's showing up on the screen there, the very bottom, but yes. Equals 20 mLs. Okay? That's the total volume or concentration if I had 1 gram in 20 mLs is the same as 50 milligrams in 1 ml. Okay, but I'm trying to figure out how much diluent I need to add. I already have a volume of powder that exists. So if I put 20 mLs in there, and just figured that would be close enough, my actual concentration would be 20, it'd be 1 gram for 20.4 mLs, right? Because I already have a volume for my powder. You have to take into account, just because the powder doesn't dissolve, just because the powder dissolves in the water doesn't mean that it doesn't take up a volume, okay? So we have to think of that. So, what do I need to do? So that's how much I need to add, volume-wise, to 1 gram to get the concentration I need. Proportional proportion method, we would just be cross multiply and divide. And we still have to do the same. We still have to do the same minus the 0.4. Does everybody understand why I want to minus that 0.4?
Because it's already in the bottle.
It's already in the bottle. It's an existing volume that's sitting in the vial already. So when I add 19.6 mLs, the combination of the volume of the 0.4 and the 19.6 creates 20 mLs total, which includes my medication. So I have that 1 gram and 20 mLs. Okay? So magnesium chloride comes in 2.2 MEQs per MEL. The order calls for 15 mLs. How many milliequivalents will that be?
You just times it, right?
15 times 2.2.
So the only difference between this and the other ones that we do is usually we have a concentration and we're trying to figure out a milligram or a milliliter volume, right? We have the milligrams, we have the dose that the doctor's ordered in milligrams, and we're trying to find out how many mLs to give, right? This is flip-flopped. We already have the volume we need, so we need to figure out how much is in there, milliequivalent wise or milligram wise, depending on the question. So this one, pretty easy. All we have to do is we have our starting point. 2.2 per ml, right?
Yeah.
A lot of chicken scratch there. Okay, so my available 2.2 milliequivalents per ml. If you can't read that, that says available. If you're wondering. What I have is 15 mLs. This is why I like dimensional analysis. Do I have to remember a formula of what to put on top and what to put on bottom? No, I just know that I want to cancel out mLs and find out what my milliequivalents are. So my conversion factor is my available. Okay, so what needs to be on bottom now? 1 ml, because remember on the other ones, when we were trying to figure out figure out the other way, we would have the milligrams on the bottom because that's what we'd be canceling out. But this time that's what we want our answer to be. So top will be 2.2 and EQ. Cross those out. 15 times 2.2. 33 ME. Proper way is capital E, I'm sorry. Okay, so 33 MEQs and 15 mLs. Okay, last semester the concern was, what am I supposed to do? I've never seen a milliequivalent. What's a milliequivalent? What am I supposed to do with that measure? How many milligrams is that? That's not what I'm asking for. All I'm asking for is how many milliequivalents that is. So I could add, remember like when I started dimensional analysis, I could say, I have this many buckets. Each bucket has this many fish in it. I want to know how many fish I need. How many buckets do I need? It goes for anything. And you don't have to know what it is. I could say there's 15 walleyed salmon in one bucket for each bucket. Okay? Do you know what a walleyed salmon is? No, I think I just made that up. I don't even know what a walleyed salmon is. But the point is, it doesn't matter. Because if all I'm asking for is buckets, who cares? Right? So milliequivalent, it's a new unit of measure for you guys. You probably will never see it again other than in potassium orders on from doctor's orders. That's the most time we give it milliequivalents is in potassium. You don't see magnesium orders in milliequivalents. It's actually in milligrams most of the time. So it's just a unit of measure, just like pounds, just like anything else. Okay, kilograms, grams. It doesn't matter. All that matters is that you understand the math that goes with it. Okay? Okay, let's go back. Is this helpful?
Yes. Can we do more of the powder ones, please?
Let's see if there's one on here.
Or can you mix them up?
Want to do this? Let's do this one, 1.8, really quick.
Yeah.
Okay, so here's one. A child weighs 46 pounds and has a mild infection. Gantricin oral suspension, 250 milligrams POQ6 hours is ordered. The recommended dosage is 120 milligrams per kilogram per day in 4 equally divided doses. How many milligrams in a recommended dosage? So here's where people went wrong with this.
Can I find out what the 45 pounds is in kilograms, right?
46 pounds, that's part of it. Everybody got that part. What they missed was, what is specifically being asked for?
Equally divided in 4 doses.
So what everybody was giving me was the dosage for a day. The question is,
What is the dose?
what is the dose per dose? Okay, so let's do this. Recommend dosage, let me just write this down on my piece of paper.
46 pounds.
46 pounds.
250 milligrams ordered.
Dose is 120
Per kilo. 120 milligrams.
120 milligrams per kilogram per day. And then
What's a recommended dose? Divided by 4.
how many milligrams are in a recommended dosage? Okay, so let's really quick. Does that 250 milligrams POQ6 hours matter to us at all?
If that's the order.
That's the order. But does that have anything to do with my math for this question?
Not exactly.
No, it doesn't at all. Okay. So my orders for 46 pounds, 120 milligrams per kilogram a day, and what's my recommended dose? And that's right here. Okay. So
do this first, 46 pounds. 2.2 pounds for 1 kilogram, right? 46. 20.9. Okay. Now I have 120 milligrams per kilogram, which is 20.9 per day. So I will take that 120 times it by 20.9 equals, so in a day, the recommended dosage for my patient is 2508 milligrams per day. Is that my answer?
No, you have to divide it by 4.
I'm dividing it by 4 because that's how many times in a day I'll be giving it, because I'm finding out the recommended single dose. So 25 milligrams per 5 times a day.
627.
Okay. That is based off the weight of my patient, so that is specific to my patient only. If I was a 50-pound patient, guess what? That number will be different. If I was a 100-pound patient, that will be different, and that's important because pediatric population, we do everything weight-based. So that every pediatric patient has a different dose. You can't just give a blanket dose like you do with adults. Okay, with adults, I know that if I'm going to intubate somebody, I'm going to give them 5 milligrams of Versed. Okay, now it's going to make them sedated and go to sleep so I can put a tube down their throat. With a pediatric patient, I know that if I'm going to medicate them for the same procedure, it's going to be 0.1 milligrams per kilogram. So that way it fluctuates for every patient, so I don't overdose my pediatric patient. Okay, so very important. So there's the math for that. Let me put the lines here so you guys can see when a new problem starts and stops and starts. Okay. And if you come up with a question that's different in the meantime, like you had something else that came to mind while we're doing this, I'll holler it out so I can do it on the board.
There's like an A, B, and C one.
Yeah, let's go down to the open questions. Let's just do this one really quick. Okay, cefazolin, 500 milligrams is ordered. Cefazolin is supplied as a powder in a vial. Directions on the vial state: add 10 mLs of sterile water for injection for a concentration of 100 milligrams per ml. How many mLs are needed? Okay. So what are we going to do here? What matters? Does any of these instructions matter?
No.
No. The only thing that matters is right here: 100 milligrams per ml. 500 milligrams is the order. So I'll do dimensional analysis using 500 milligrams as my starting point because that's what's wanted. And I'll use 100 milligrams per ml for my conversion factor for the math. So I can just look at this and tell you right now what's my answer?
50 mLs.
5 mLs.
What?
Just 5 mLs, okay?
Oh wait, 10.
This 10 mLs of sterile water does nothing for me. All it really matters is what's ordered and what's available. 100 milligrams per ml.
Oh, okay.
Okay? Pay no attention to the other stuff. This doesn't have any labels on it. I didn't get any label questions. Okay? Here's another one. Ticarcillin. 700 milligrams is what's ordered. Ticarcillin is supplied as a powder in a vial. Directions on the vial state: add 2 mLs of sterile water for injection. Each 2.6 mLs of solution will contain 1 gram of ticarcillin. Okay, so what do I need to do? Do I need to pay any attention to 2 mLs of sterile water for injection?
No.
What is the only thing that matters to me?
2.6 mLs per 1 gram.
2.6 mLs per 1 gram or 1 gram per 2.6 mLs, right? That's all that matters.
And
So-
700 milligrams.
And it's 700 milligrams is my order. So my order, 700 milligrams.
2.6. 1.82 mLs.
What's wrong with that?
You need to change it to this.
Right? Does it all cancel out?
Yep.
What is left?
7.
The mLs, right? So I know I have set it up right if the desired item is what's left. 700 times 2.6 equals divided by 1,000 equals
1.82. Equals 1.8. I kind of did that like a quicker way, since I knew 7.
you could have
700 to 1,000 is 0.7.
well, you don't need this if you just put this 100 though. 1,000 I mean. Right off the bat.
But no, I just did 700 over 1,000 is 0.7, and then I did 0.7 of 2.6.
Right. Which would
Get
is all the same numbers and in the same spots. That'd just be me taking this here and putting it over here. Is it still on the bottom? Right. Yes. You started to raise your hand.
Well, I was just gonna say, we always round to the nearest 10th.
If it's over an ml,
Right.
if it's over an ml, you round to the nearest tenth. If it's under an ml in volume, you can round to the 100th. Why is that? Because the 1 ml syringe can actually measure out accurately to the 100th place. Anything over an ml syringe only measures to the 10th. Okay?
2 syringes.
Yeah, you can do 2 syringes then. But what else? Let's look at some of these. I'm not going to do the math for this one. But what are the important parts of this? There's a lot of jibber jabber here, right? Jibber jabber. So what really matters? My order, which is 125 milligrams,
5 mLs.
and my 5 mLs for 250 milligrams, or 250 milligrams for 5 mLs, however you want to say
So
it.
that'd be 2.
All of this business in the middle is nothing. It's just distracting information. Why am I putting distracting information on this?
So we can recognize what's important.
You recognize what's important because when you look at a vial to do your own mixing, to inject Rocephin in the pediatric patient, because they have a little urinary tract infection, what's going to be important is that you know what to pull off of the label when you're mixing the medications. Because there's going to be no pharmacist over your shoulder mixing it for you or helping you with it. When you're in the ER setting, you just pull out the vial and you read the instructions on the vial, you do the math, do the mixing, and then you go to the bedside and give it to the patient. Okay? So you need to be competent in your math and competent in understanding what's important from the label. Okay? That's why we do this. Let's look at this one. What's the important parts of this one?
250 milligrams and 5 mLs for 100 milligrams.
Yeah, 100 milligrams for 5 mLs and 250 milligrams. That's all I need to do my math. And I am always surprised how many people will somehow get 29 mLs somewhere in that math equation. All that matters is the order and what's available, right? Is there any other questions?
Are there any in there that ask you for the powder volume?
The other, like we had done,
Say, I'm guessing it would be the exact same, but.
we did that one. That one. We've done some similar. If not, I will make one up. I will do that, because I care.
Thank you.
See if there's not one.
I gave you.
There it is. There's one.
Yeah, that one.
Okay, oral suspension. Hold on a second. We don't know what kind of medication is. Does that matter?
No.
No, we're just trying to figure out whatever it's asking for. Don't let anything distract you. Okay, oral suspension once reconstituted is to have a dose of 250 milligrams per teaspoon. The dry powder is 6 grams with a powder volume of 21.8. How much water must you add? Okay, so what are the important things?
250 milligrams per teaspoon.
250 milligrams per teaspoon. 6 grams is how much volume?
Dry.
21.8. I can spell. Now you guys will see why. That awesome handwriting right there is the reason why that Medicare makes them have doctor order entry online now. Because of that awesome handwriting. Okay, so the important parts from that were the 250 milligrams per teaspoon, and the 6 grams is 21.8 mLs of dry powder volume, okay? First things first, what do we know right off the bat? This is, what's it asking for?
200 ml.
How many mLs am I gonna add, right?
Yeah.
Okay, but what's the concentration that I wanna get to, Ian?
250 milligrams per 5 ml.
So teaspoon right now, and where we can automatically know by using our fancy conversion chart, which hopefully most of you committed to memory by now, 1 teaspoon is 5 mLs. So let's just do that really quick. 250 milligrams is 5 mLs. Okay? So using dimensional analysis, 6 grams, 1,000. Oh, am I doing that right? No, why? What's wrong?
You have to have the grams on the bottom.
I have to have the grams on the bottom, why?
So
You
they
could
cross
can
off.
cross out
So
grams.
I can cross off. So what way does this, what's next?
Times 5 mLs to 125 milligrams.
Or 250 milligrams?
Oh, sorry, yeah.
My awesome handwriting, it's hard to tell.
It's 25 degrees.
So, here you go. Does it look like everything crosses out?
Mm-hmm.
Yeah.
So 6 times 1,000 times 5 divided by 250. 6 times 1,000 times 5 equals, divided by 250 equals
120.
120 mLs. Okay, so remember, all I have done at this point is come up to this. My concentration of 6 grams per 120 mLs. That's it. That's all I know right now.
Mm-hmm.
Is my answer 120 mLs though?
No.
No.
You have to subtract.
I have to subtract because I already have 21.8 mLs of volume for the 6 gram powder. So 120 minus 21.8.
98 too.
Is it 98.2 you said?
Mm-hmm.
So that's my actual answer.
And that's for how much we would have.
That's
to
how
add
much
to water.
exactly I need to add to the powder to get a final concentration of what?
120.
No, that's the volume.
Oh.
250 milligrams for 5 ml or
6.
6 grams per 120 mLs. But we want to get it to the lowest value, so 250 milligrams for 5 mLs, or what would even be lower? 50 milligrams per 1 ml, right? Okay, but all it's asking for is a 250 milligrams per 5. Why is it 250 milligrams per 5? Because the most common dose is a teaspoon. So that's why they make it that like that. Okay. Because you're not going to want some mom trying to figure out how to figure out an ml, right? What's an ml? All I have is teaspoons in my cooking cabinet, right? Does that make sense? Okay. Any more questions about that? Let's see here. Oh,
One right below that one, maybe.
the one right below it is penicillin G comes in 1 million unit vial. 1 million, yes. $1 million. I see there's no pleasing you. Okay, the medication needs to be, that's Austin Powers for those of you that, well, Dr. Evil from Austin Powers. For those of you that aren't laughing, if I have to explain my jokes. So, 1 million unit vial.
It's a good movie.
The medication needs to be reconstituted with 4.6 ml to have a concentration of 200,000 units per ml. What is the powder volume?
No?
See what now?
Did I do that wrong?
Okay,
No, it's 0.4,
I'm running out of paper here.
because you have to subtract the 4.6.
Do you need some paper?
Yeah, if somebody will hand me a piece of paper, because this is an impromptu lecture session. I did not come formally prepared. Okay, so what do we know?
Million.
We have 1 million units per vial. 1 million units per vial. And I need a 200,000 units per ml. And I need to add 4.6 mLs. Right? So I wrote those things down. I have 1 million units per the vial, 200,000 units per ml is what I'm going for, and I'm adding 4.6 mLs. Okay, so what do we want to do first? That tells me right there how many mLs will be with 1 million units after I'm done mixing, right? So that will be 5 mLs based off of the math in my head. You guys can check it with your calculators. So I know that right off the bat, and my end result's 5 mLs when I add 4.6 to it. So just like the other one, I need to do some subtraction, right? 5 minus 4.6, 0.4 mLs volume of what? Of powder. Okay? Does that make sense? If somebody gets drawn when they do their 19 and 20 test for these questions, they're going to be lucky. That's all I'm saying. Okay. Anything else? Anyone? Anyone? Bueller? Today's 90s movies day. Oh, that was late 80s. So.
Yeah.
Wasn't it?
Yeah, that was 80s. That's like the 80s.
Has anybody watched the Goldbergs yet? I've talked about it a bunch of times. I love that show too. The Ferris Bueller's Day Off is
That's a great movie.
that's a great movie, but the Goldbergs is all about growing up in the 80s, and they do a whole episode about Ferris Bueller's Day Off. It's hilarious. The other one is of equal value when it comes to hilarity, blah, blah, blah. is the New Kids on the Block one. That is hilarious. The Goonies is a good one too. So, all right. We ready to move on? Chapter 2. This is a little bit of both. So, actually, let me do some chapter 21 really quick. Chapter 21 really quick. I'll just make these up because they're really easy to make up. And then we can both be surprised when we get the right answer.
21 and 22.
21. I'm going to do 21 really quick and then I'll lecture on 22. Okay? Because I said this last week and you can confirm with the recording, and I said it in the other class too, that you can wait to do the homework for 21, 22 because I only lectured on 21, planning on lecturing 22 today. So I got a lot of emails saying, I didn't know that you weren't going to lecture. I mentioned it, but that's okay. You can take the test more than once. Okay. So here we go. I have 450 mLs of D5NS. How much dextrose? How much sodium chloride? Okay. What do I need to do?
Since it's 5%.
5%, right? Dextrose 5%, that's what D5 stands for. Remember that these are two separate things. Okay? So, what's a 5% solution mean? Mother father.
5 mLs per.
Not 5 mLs.
5 milligrams per.
This is what I have, 400 mLs first. 5% solution is 5 grams per 100 mLs. Does that make sense why that's a 5%, what a percent solution is? What is any percent? If I change any percent to a fraction, no matter if it's my mortgage rate,
It's a number over.
or it's my car rate, or it's my percent solution, it's a something over 100. That's the fraction. Okay, so for solutions, the fraction is grams per 100 ml. So a 5% solution is 5 grams per 100 ml. What if it was a 10% solution? 10 grams per 100 ml. What if it was a 25% solution? 25 grams per 100 mLs. What if it was a 0.5% solution? 0.5 grams per 100 mLs. All I am doing is I am taking this percent sign away, putting it over 100 and putting a grams there, right? That's all I'm doing. So, this is my now conversion factor, because I know I have a 5% solution. If I have 3 unknowns, I can figure out the 4th, right? So, what goes on the bottom here? What goes on top? 450 times 5 divided by 100? 22.5 grams of dextrose. Okay, that's A. That's half of the problem. B. How much sodium chloride? What's the other part here? Normal saline, right? What's normal saline? I mentioned this last week.
0.9%.
Normal saline is 0.9% solution of NaCl. Normal saline is 0.9% solution of sodium chloride. That is what normal saline is. Memorize that. Okay? You have to know that for nursing school. That is a mandatory requirement. It's expected that you know that before you start. Normal saline is 0.9% sodium chloride. That's what I'm asking for, sodium chloride. So perfect. So I have 450 mLs, right? Now, what is my conversion factor?
0.9 grams per 100.
Right? That makes sense?
Mhm.
Cross out my mLs. So 450 times 0.9 divided by 100 is
4.05
4.05 what?
grams of sodium chloride.
Grams of NaCl. Okay? Is that showing up there? Another one? Uno más, right? Uno más. No wheezing the juice. What movie is that from?
I have no idea.
Oh, it's another 90s cult classic. Encino Man.
Oh my goodness.
OMG!
God.
You guys, half of you guys weren't born in that decade,
I
so.
remember that movie.
It'd have to be a poppy.
Pauly Shore and who? Who was Encino Man? Brendan Fraser.
Brandon Fraser, absolutely.
No wheezing the juice.
That's Georgia the Jungle. That's who Brendan Fraser is to me.
Okay, Brendan. Did I say it right?
Oh, I don't know.
I know what it is.
That's Georgia the Jungle.
Okay. Let's make up another one.
Wow.
800 mLs of D2.51 quarter NS. Okay. So this is, I have one that's similar like this on the homework. So what commonly happens is people draw the line in the sand in the wrong place. They draw the line and to split it here. So they have D.5 and 1/4, and they're trying to figure out how to get 1/4 to go with the decimal place. And then they have 0.9% for the normal saline. That is incorrect.
That's a type of normal saline.
This is where I draw my line. Okay. Dextrose. What's the normal saline?
0.9%.
0.9% of what? Sodium chloride. Okay. So dextrose first. 800 mLs. What's my percent solution?
2.5.
2.5% or 2.5? So what's on top?
2.5
2.5 what?
grams.
Grams per 100 what?
Those
Okay. Cha-ching, cha-ching.
20.
Wall, wall, bing, bang. 800 times 2.5 is
I have no idea, but it's 20.
1700, right?
Yeah.
Divided by
Divided by 100.
20. I got 20.
800 times 2.5? Yeah, you're right.
2,000.
The hair niner in there. Walkie ducky. So 800 times 2.5 is what?
2,000.
2000.
Hey, I'm just doing it in my head. You guys are there to have the calculators. Okay.
That would have been medication error.
That would have been a medication error. What right?
20 grams.
Dosage.
Dosage. I had the wrong dose. Okay. NaCl. Okay, I have quarter NS.
0.225.
So, what do I do?
0.9 times a quarter.
Times 800. Wait, no, that's 1.8.
So 0.9 divided by 4
0.2.
to make that a quarter is what? 0.225%, which is 0.225 grams per 100 mLs. $800 times 0.225 divided by 100,
1.8.
1.8 grams. Okay? We good? Okay. Let's go back to lecturing. Actually, let's take a 5-minute break really quick for me. Make it a 2-minute break. Okay? Stretch your legs. I'll get the bathroom first.
He was doing 21 just now.
I must have missed all the insurance.
Oh, really?
I went into Rise and I was like,
No, we haven't gotten the
you guys
23
fix
yet.
this.
I know I did it.
We did the homework.
Yes.
Yeah, exactly.
And the worst thing happened, I got like 5 problems into it, and my computer kicked me. So that's one try.
Mm.
Mine was the same, I'm gonna talk to you about birth. Were you in Firefox?
No, I use Google Chrome.
There you go.
That's
That's
huge.
It kicked me. But I live in the country. You get kicked all the time. You can be in the middle of anything.
I'm in the middle of town. I
Like 6 or
done it the other way where it's just a regular Internet Explorer. And I had problems, so
that's
he
good.
said,
It's you
you
gave.
really need to
Is that
go
with
with
an
Firefox.
upgrade?
I settled that out. And then today,
Sorry.
halfway, 20 minutes in, it starts.
Oh, I only
Looking
got
at-
5
She
problems
engaged
done,
you.
and it kicked me. And I was like,
Last week.
Yeah.
3 people all got to be this week now.
did you reset all those that asked you to? Because we got kicked out of our computers.
She was like following all the.
What do you mean you got kicked out of your computers?
I live in the middle of the country, and my computer will constantly kick you out. And I did 5 problems, and it kicked me, so I went in and did the second one. I got a D on it. But I just wanted to see if I could do 22 without help. Obviously, I couldn't. I got a D on it. But my first try would have gone in with like 5.
Oh, I guess video mute doesn't work on this. There it goes. Make sure I got everybody that showed up late.
Sorry,
I had a really good excuse.
I did too. How come you're moving so slow?
So I'll crank through some of these and then we'll do some on the board, okay? Okay. So, the way things work in the hospital setting is everything that goes in IV is going to be mLs per hour, right? Especially if it comes from an IV pump. The only thing that IV pump recognizes is mLs per hour. So if I have a critical drip that's supposed to be running at 10 micrograms per minute, my pump only recognizes what? mLs per hour, so I'll have to figure out what that, based on the concentration and the rate and all that stuff, what mLs per hour is, so I can put that in my pump so my pump can run it at the appropriate rate. So remember that in the very beginning when I start dimensional analysis, I was going to mention that both at one time both top and bottom will be important parts of the dimensional analysis because you'll have to have a component, a time component. This is where we start getting into that with dimensional analysis. So, electronic infusion pumper controller is calibrated in mLs per hour, okay? So if I need to figure out, let's say I have an order that says, Doc wants this ran 800 mLs over the next 4 hours. So I just take my total mLs ordered, so 800, over the total hours ordered, 4 hours, and do the math. 800 divided by 4 is? 200. So my actual rate will be 200 mLs per hour. For 4 hours will equal my 800 mLs. Do you see the relationship? Okay.
Is 3 drops.
That's the basics. The most basic one we do. So let's look at this. Order is 250 mLs. By the way, we will never run D5W by itself. It always has some sort of volume medication in or something. But D5W, 250 mLs over the next 2 hours by infusion pump. So, what do I need, what is gonna be my first step?
250 ml.
250 mLs divided by what?
2 hours.
2 hours. Remember the total IV volume divided by total time is gonna give me my mLs per hour. So 250 mLs on top divided by the 2 hours on the bottom, which will equal 125 mLs per hour. Remember, that's what the pump understands. A volume over a single hour. Total or ordered time, 125 ml per hour. Okay. When it's less than 1 hour, this is where it gets a little complicated. Like, let's say there's a medication called amiodarone. We give it to patients who have had VTAC. Okay. Ventricular tachycardia, that's for those of you who've taken anatomy, is not a good rhythm if you plan on living. Right? That's the one that they shock. Clear, shock them, right? VTAC. So if they keep doing that and we keep having to shock them, we give them a medication that will hopefully stop that. Okay? And that medication is amiodarone. We give the first dose 150 milligrams and 50 mLs over 10 minutes. How do I set my pump for that? 150 milligrams and 50 mLs over 10 minutes. I think it's 50 mLs. No, it's 100 mLs. 150 milligrams and 100 mLs over 10 minutes. So how would I do that? What I do, I take my total mLs ordered divided by total minutes ordered, then multiply it by 60 to make it my hour, right? Dimensional analysis, think about it. So what's my total mLs ordered? 100, no, that's the milligrams. It was 100 mLs. The concentration was 150 milligrams per 100 mLs. So 100 mLs divided by how many minutes? 10 minutes. Okay, so multiply it by 60. So what's my rate? 600, right? 600 mLs per hour will run my 100 mLs over 10 minutes. The only reason I know that's right is because I know that when I program my pump for amiodarone, I've always put it at 600 at first. So we're right, okay? Here's one that's given. 500 milligrams IV and 50 mLs over 30 minutes, okay? So what's the important part here for the mLs per hour? Does that 500 milligrams count?
No.
No. The only time 500 milligrams will count is if I ask if this is a safe rate. In nursing school, this will be an addition to it that says you can only run 50 milligrams an hour max. So you'll do all your math and then they say, is this a safe rate? That's an addition during nursing school that I don't throw on you in this class. But because some medications require a maximum rate. Mainly antibiotics to avoid seizures or allergic reactions. So,
I swear there was some in the homework.
if there is some in the homework for a safe rate,
There was one.
is there one? Okay, I didn't think I had
But-
that in there.
It was a safe, not necessarily.
Does it safe dose or safe rate?
Safe weight.
Okay. So, 500 milligrams IV and 50 mLs. Okay, so what's the important thing to figure out my rate here?
50 mLs and then 30 minutes.
Okay. So, total mLs ordered was 50 mLs. Don't pay any attention to that 500 milligrams. That doesn't do us any good right now. We're only thinking of volumes. So, 50 mLs divided by the 30 minutes times 60. That gets us our hours. Okay, that's our dimensional analysis for it. Remember?
102.
Did you just carry over your calculator?
Yeah.
You're getting one answer.
Right, that's why I did it.
Uh,
I got 99.999999 if I do it that way.
Yeah,
I got 100. Mine.
Well,
my
how did you
calculator.
run it to 102 then?
Or no, I mean, this is 1.66666. I just put it to 1.7.
Oh, that's why. So if you just carried it over on your calculator,
That's what mine did.
50 divided by 30 equals times 60 equals 99.99999999999.
Mine brought it up to
Right.
100.
So 100, so, okay?
No, that makes no sense.
How does that make no sense? Tell me where you're confused.
Okay, because if you're doing it like they have it at the bottom,
This is dimensional analysis.
right?
Remember, now we have two parts to this problem. It's not just mLs by itself times 1 hour and 60 minutes. It is now, it has a new component. It's a rate. So the top and bottom both count. So I need to change this to hours and change this and leave it because that way my things are canceling out, leaving the same. So 50 mLs per 30 minutes. Remember I said I want this 50 mLs infused over 30 minutes. So that now is my starting point for dimensional analysis. 50 mLs per 30 minutes. But 30 minutes can't stay because why my pump only reads what?
mLs.
mLs per hour. So mLs is still good. I don't have to do any conversions there.
So it'd be 300 over 30.
No.
Dimensional analysis, you
Oh, so 550 times 60 is what?
300.
Is it? There's two zeros there.
3,000
There's two zeros there.
over 30, which is 100.
There you go.
Thank you.
So remember, now with dimensional analysis from here on out, it's a rate. So you have a volume component or a weight
Not
component
that part, I just
with
kept getting
the time component. Okay?
300. That's 3,000 over 30, and it would have come out 100. Sorry.
So this is that gets a little bit complicated. Okay? You have your drop factor. Okay? This is where a lot of people started straying from the homework. Okay? So this is the formula method. If you want to memorize this, memorize
It
it.
made a lot of sense.
For some people it makes sense, but we'll also do it the dimensional analysis way also. Okay? Remember this is for chapter 22 for your homework that's 21, 22. Okay? So here's the thing. A lot of times we'll, like especially in the EMS setting, where I don't have a fancy, or emergency medical services in the helicopter, I don't have a fancy pump all the time. Or what I do have, I have a pump that has 3 channels and 3 channels only. So if I have a patient on a bunch of critical drips, I'm going to put the critical drips in the pump tab because it's calibrated and works great. And then if I have like normal saline running at 100 an hour on the side, then I'm just going to run it at 100 an hour using my roller clamp and control and watch the drips. And I can calculate a pretty close amount of volumes per hour based off of how many drips per minute I see. Okay, so that's when drips per minute actually matters. Do we use it in the hospital setting very much? Not too much. Sometimes in the OR they'll do that so they can figure out, but a lot of times they just watch IV totals in general. But it's something you need to know because it's happened to me before. One time we flew up to pick up a patient from a different hospital, and we got in there and the patient was in septic shock and on critical drips. So I programmed the pump, I got out to the helicopter, and the pump started wigging out and shut down. So like, oh my gosh, we're on critical drips. This critical drip is maintaining the blood pressure. So I quickly grabbed the extra pump, our backup pump, program it, plug it in, push start, and guess what?
It does.
It gives me this huge error message, shuts off all the channels. So I don't have, now I have, instead of having 6 available channels if I needed them, I have 0 available channels. So guess what I had to do next?
Run back into the hospital.
Because I'm already flying by this point, so
Oh.
it's hard to me to run back anywhere. Break out the calculator and figure out drips per minute and start titrating critical drips based off of me watching the drop factor. While the medic was going, pump and punching the pump and getting, screaming at it. Finally got it to work, we plugged it back in and it worked fine. But there was a short time there where I was titrating her critical drips off of me counting drops. Okay? That's kind of nerve-wracking.
Yeah.
Okay? If it wouldn't have came up, that would have been a very long flight because it was 1 hour and 10 minutes from Charlotte to Phoenix, where I took her. So that would have been a very long flight, counting drops. 1, 2, 3, 4, 5. So, this is how you do it. Volume is V, so mLs. Time, something to remember. Time in this formula is minutes. Okay? So if you need mLs per hour, what do you need to do?
60.
Times it by 60. Okay? So, drop factor. All tubing is different. Okay? But it will tell you on the label when you go to rip it open that this tubing has a drop factor of 15 drops per ml. So 15 drops is what?
1
1 ml. Okay? There's IV infusion sets that are 10 drops per 1 ml. So 10 drops is 1 ml, right? What if I have a micro drip? Micro drip is the best one to use for critical drips because its drop factor is 60 drops for 1 ml, right? 60 drops for 1 ml. So the cool thing about micro drop is mLs per hour matches my drops per minute. So if I know that if I have a micro drip tubing and I have a critical drip that needs to run at 20 mLs an hour, I know that if I watch 20 drops in a minute, then I've got my 20 mLs an hour. So that's the cool thing about micro drip. So you have macro drip, which is the 10 drops per ml, 15 drops per ml, and 20 drops per ml. Micro drip is 60 drops per 1 ml. Okay. Another way to know that it's micro drip is where the drips go into the drip chamber. It is a really, really tiny metal orifice because it's very tiny drops, right? If I can divide an ml in 60 literal drops, then I have to have a tiny dropper. Okay? So, volume is mLs, time is in minutes, drop factor is based off of your tubing, okay, for ml, will tell you how many drops per minute you need to watch to get the accurate rate. Okay? So when we are figuring drops, it's drops per minute. So, remember we did this math already for the patient that's getting the antibiotic. It was at 50 mLs that needed to run over 30 minutes, okay? And we converted that to 60 minutes over 1 hour. Using dimensional analysis, we found out 100 mLs an hour was our rate for that antibiotic, right? To run it over 30 minutes, okay? So we had 100 mLs per hour. We would do the drop factor for that. I thought this continued on it, but let's do this one, okay? Real quick before I get going, can the naked eye tell me that I have 38.8 drops?
No.
So what do I have to round my drop factors to every time?
All numbers.
The whole drop. You will get it wrong if you do not round it to the whole drop. Because I cannot say, that's about 38.5 drops. It's only going to come out in one factor. The way the physics works with the orifice provided, if it's going to drop, it's going to be this certain amount of volume for that drop. So I cannot divide a drop physically. Okay? So, we talked about this. 125 mLs an hour. My calibrated set is 10 drops per ml. Right? So what was the formula?
125.
Volume over what? Not hours, but minutes. So we automatically know that 1 hour is 60 minutes. Okay, so do we have to do any extra conversion there? We can just do that in our head. 1 hour, 60 minutes. We've known that since grade school, right? Mm-hmm. Then we multiply that by our drop factor, which is
10 drops.
10 drops per ml. So 125 times 10 divided by 60 equals 20.8 drops per minute. Wait a second. That's a decimal place. What do we got to do? Round it. So the right answer is 21. Okay? This is where the rounding is very important. Okay? It's always important, rounding is, but rounding to the right whole number, hopefully we have that figured out by now. Remember we talked about this a little bit? When the drop factor is 60 drops per ml, when the flow rate in drops per minute is the same as the volume ordered. So no worry about math there. If I have 50 mLs an hour, over 60 minutes. So 50 over 60. Drop factor is what? 60 drops per ml. These cancel out.
Right.
Okay, mLs cancel out, so that gives us the 50 drops per minute. That's the nice thing about micro drop. So what's really cool in the helicopter, we have what we call select 3 tubing. And it has it's like, you know those pencils that have all the different color pens in it? You know, it's all one pen, but I can get red, green, blue, black. Oh, and then I can click it out and I get a pencil too, right? That's the same thing with select 3 tubing. On the top there's a dial and I can click it. And if let's say I'm just running fluid wide open, I'm going to have a 10 drop per ml because I don't have to really watch it. I'm just running wide open. But if I have critical drips, I can do a couple clicks and turn it to 60 drops or a micro drip, and then it's easy for me to titrate medications. So, pretty cool. All in one tubing. So this is how you do it. Remember we talked about this is the drip chamber. We played with some of the IV tubing was it last week? So that's why you need air, a little bit of air in your, so you can see the actual drops. This is for those of you who only own digital. This is a watch with the second hand, okay? So, I need IV medication 50 mLs in 20 minutes. Okay? Micro drop is 60 drops per ml. So I could do it multiple ways. I can do this regular method of 50 over 20, times it by the drop factor, and then get my numbers, right? Or I could convert it to 20 minutes to an hour, okay, which would be mLs per hour, do all that math like we did before. Either way, 150 drops per minute with micro drip. So if my micro drip is 150 drops per minute, what's my mLs per hour?
150 times 6.
150 mLs per hour. Remember, micro drip is the rate of drips per minute is the same as mLs per hour. So if I have a question on it says I have a micro drip running at 150 drips per minute, what's my mLs per hour? 150, because remember it's vice versa. I can go either way with that conversion. Okay, D5W, order to infuse 100 mLs an hour. Okay, so I have 10 drops per ml, so I can use my fancy formula. I have 100 mLs over 60 minutes for my mLs per hour. And then I have times it by my drop factor of 10 drips per ml. Okay, showing the math there. 100 times 10 divided by 60. 16.6, but is that the right answer?
No.
It has to be rounded to the whole drop. So I would watch for 1 minute to see if I get 17 drips. And then I would control that with the roller clamp. Okay, find out 17 drips per minute. 2 grams over 30 minutes, okay? I place 2 grams in 100 mLs of fluid, okay? So the drop factor is 15 drops per ml. I'm going over 30 minutes, so do I have to convert hours to minutes for that fancy formula? No. I can just put my 100 mLs over my minutes, multiplying that by my drop factor, getting 50 drops per minute. So 100 times 15 divided by 30 equals 50, or 100 divided by 2. Either way. Multiple ways to do that math. We'll do some of these on the board, okay? We'll make some up and try to figure them out both ways. Okay? "20 MEQs of potassium chloride to be placed in 1,000 mLs of fluid to be administered at 2 MEQs per hour. Uh-oh. Wait a second. All I know is mLs per hour.
Just use MEQs.
So what do I got to do?
Got it out.
Okay. I have 1,000 mLs that needs to be infused that has I have 20 MEQs over in 1,000 mLs. I need to be at 2 MEQs per hour. Okay. So first of all, I need to do the mLs per hour because that's what I got to start with. Okay. Does drop factors take into account of medication weight? No, they don't. I have to come to a drop factor formula with mLs per hour. Okay, figure it out. If I don't have that, then the drop factor formula doesn't work. So using my dimensional analysis, I figure out that there's one. I will run at 100 mLs an hour to get my 20 in 1,000 over 10 hours. Okay. Right? We'll do some of these on the board. So I know now 100 mLs per hour is going to be my desired rate. So now I can do my math for the drops per minute. Okay. So I have my 100 mLs over 60 minutes. This is showing dimensional analysis the whole way. 100 mLs over 60 minutes times my drop factor will get me 25 drops per minute. We'll do these step by step on the board, I promise. But you can write these things down. Must have a hole in my lip. Alright, so sometimes we have to adjust the flow rate. Let's say I give you, and some of you that have already done the homework will know what I'm talking about. But let's say I give you an order to run this liter over the next 10 hours. Okay? So I give you 1,000 mLs over 10 hours, which would be 100 mLs an hour. So I do my math wrong at the first place, and at 4 hours, I go in and check my IV bag, and I've given 600 mLs. Am I running too fast? Mm-hmm. Right? I've done a little too much. So now I still got to go in there and correct my rate to run the remaining 400 over the next 6 hours. So that way that at 10 hours, I'll completed a liter, correct? 66.
So 67.
So that's when this kind of matters. So we have to recalculate our mLs per hour and then put it in the drop factor for doing drops, or change our pump to mLs per hour at the correct mLs per hour, okay? So there might be a couple questions on the homework, because it's a random, remember, it randomly gives a bunch of them.
There was one.
54, yeah, we'll do that one on the board. So what I mean is, it will ask you, okay, it will ask you to calculate the new rate, and then it will say, based on your new rate, what percentage change did you do to get the new rate?
Somebody said it. I practiced getting the new rate.
Okay, so some of them have it and some of them don't. Some of them will have you recalculate the rate and won't ask any questions about the percent change, and some of them will ask you for the percent change based on how lucky you are with the automatic random selection for your questions for your exams and your homework. So you have to have your remaining volume and your remaining hours. Okay, remember, so let's talk, if it was that 400 mLs left over 6 hours, right?
So
I would take 400 divided by 6 to get my mLs per hour. Okay? Which would be
66
66.6 mLs, or is it 66.66? So 66.7. 66.7 divided by how many minutes? 60 times my drop factor will give me the new drops per ml, or drops per minute. Okay? Then you take the new drops per minute minus the old drops per minute over the old drops per minute. That will give you the percent change. So let's say I had to change it from 25 drops per minute to 38 drops per minute to cover that time. So I would put 38 minus 25 over 25. Okay? We'll do a math problem that has that exact math. Okay?
It's a 52% change.
It's 52% change.
But it says adjusted and then ordered. It's really not ordered,
It's the ordered rate, because I said I want 1,000 mLs over 10 hours. So 100 mLs an hour
But you
is
said
my
it wrong.
ordered rate.
But you said it wrong.
But I said it wrong. So now I am adjusting it. So my new drips per minute and my old ordered drops per minute. I have now changed what I am doing.
Right.
That's the ordered is what's the original.
Okay.
Okay, and we'll do one of these on the board, I promise. This is just one in the PowerPoint you guys can go through. Okay, but we'll just talk about it. 500 mLs to run over 10 hours. So 500 divided by 10 is 50 mLs per hour, right?
Yeah.
Drop factor is 60 drops per ml. Great. That makes it easy. Why?
Because there's 60 drops now.
Because we know that
60
there's
mLs.
60 mLs. I mean, there's whatever I program my pump for mLs per hour is going to be the same drips per minute. So 60 drops per ml or micro drip. So I'm running at 50 drops per minute. After 2.5 hours, I find that 300 mLs are remaining. Am I on time?
No,
No. What should be left?
no.
250. If I ran it for half of the time, right? So I'm off by 50 ml. So I got to figure this all out. So I have 2.5 hours to infuse 300 ml. So I'm going to have to change my rate, right? So 300 mLs divided by 2.5 is going to give me the rest, or 10 hours, sorry. So 2.5 hours, I find 300 mLs remaining. So I'm way ahead of schedule. I apologize, I read that wrong. So now I have 7.5 hours to infuse the other to infuse 300 mLs, correct?
Right.
Okay, based off of what this question says, you can read it read the paragraph and interpret as you need to. But so I have 300 mLs divided by 7.5 hours. So what do I need to change? What's my new rate? 300 mLs divided by 7.5, right?
Yeah. 340.
Because that's the new rate to get done in this 10-hour time. So now I'm running at 40 mLs an hour.
Divided by 60.
Okay, so what is my new drip factor with micro drip?
1.
40 drops per minute, right? Because remember, mLs per hour is the same as drops per minute on micro drip, or 60 drops per ml. So 300 divided by 7.5 gives me my 40 mLs per hour with micro drip is 40 drips per minute. Okay. So what would be the percent change?
So 50 minus 40 divided by 40.
50, or would it be 40 minus 50 divided by 50, which will give me a negative number or a decrease in my percentage. Right, I'm decreasing my rate by this percentage. Okay?
50 minus 40 divided by 50.
Remember, because it's adjusted drops per minute, the new drops per minute minus the order drops per minute over the order drops per minute, right? So here it is. We talked about this. We have a new rate we have to figure out because we have 300 mLs, we're ahead of schedule, and still it's going to go over 7.5 hours to make that, so we can make that 500 mLs in 10-hour rate, right? So 300 divided by 7.5 is the 40. Using my fancy formula, 40 over 60 times 60 is my 40 drops per minute. That's now my new rate or adjusted flow rate. Adjusted drops minus the old order of 50 divided by 50. Why is it 50 divided by 50?
Order
Adjust.
Because if I was doing percents, 50 over 50 would be 100%, right? So my original was the 100%. And now I'm trying to figure out my percent deviation from the original 100%. So that's why I have the order drops over the order drops here, because that's my 100%. And now I'm doing the math to figure out what the difference was with my adjusted rate. So that's why it's like that. Okay? So 40 minus 50 is negative 10 over 50 is negative 0.2, which is negative 20%. So I made a change, a decrease, 20% in my rate.
Makes
If you're-
sense.
Do math
It
problems.
makes
if you're-
sense.
You want me just to start cranking them out on the board?
Yes.
Yeah, that one
That
number.
would work.
that-
Let's do that.
54.
Let's do that. You guys can go through this with your own time. There's only about 3 more questions left there.
54 on 565.
Please do some on the board, because I failed them all, I'm sure. You can't find them formulas.
So, 22. Chapter 22. One of them that Justin found yesterday was number 54
On 565.
on 565.
Yeah.
Question what question?
54.
565?
Hold on. Not 565 is the answer.
Oh, that's the answer. Sorry.
54 on 552. 552, page 54. Order is 250 mLs. I can write right. To infuse over 3 hours.
Let's go to 215.
I've lost my place, okay? At 21 drops per minute. Drop factor. Okay, 1.5 hours. I have 200 mLs left. Okay. Make sure that's on the board here. So 250 mils over 3 hours at 21 drops per minute. Drop factor is 15 drops per ml. And at 1.5 hours, I have 200 mLs left. So what do I know right off the bat I have to change my mLs per hour to? Minutes. Well, but what's the problem here?
You have to do
Am I on schedule?
No, you're
No.
not.
I'm not on schedule, am I? Right? Because I've already gone half the time, but I still have a lot left. Right? Because half the time, if I divided 250 by 2, it'd be 125 mLs left. And that would be on schedule. But I'm not that, am I? I still have more than that left. So I have to increase my rate. Right? So, what do I need to do first?
200 divided by 1.5.
Right? Would equal
133.3. Continue.
okay. Then what? So let's remember this is our formula, and then I'll show you how to use dimensional analysis for the same problem.
2.2.
So now I'm left with drips per minute.
2.2 times 15.
So 1.33.
33.3 continued, but 33 drops.
So 33.3 GTT per minute, right?
Wrong.
34.
It's 33.
Right. I can't have a decimal place. Okay. With dimensional analysis, guess what? I can just get rid of this step. Okay. What do I know? 200 mLs over 1.5 hours. You can look at this like a concentration. What are the two things that are still there? Milliliters and hours, right? So this is the same math-wise, and when it comes to ratio and proportion, as 133.3 per hour, right? So if I'm looking at it, because there's still mLs per hour. So here's what I can do. Let me just make that so it works. mLs per hour. This is dimensional analysis. What's next? What has minutes in it?
GTT.
Okay. I'm wanting to find out drips per minute,
Oh,
right?
you need GTT ML. You need the drop factor.
Okay. So this is where you can go like this. 15. What needs to be on the top? What do I need to have left over? Drops per minute, right? So I want minutes to be left on the bottom, drops to be left on the top. Look what crosses out. Look what's left. Drops are on the top, bottom is minute. So now I have my drop. So I don't have to remember a fancy equation for that. We're trying to figure out a formula. If I just start with what I have. So hopefully that adds up, right? 200 times 15 divided by 1.5 divided by 60. 3.3.
Isn't it 33.3?
33.
Okay. Is that the same answer as the fancy remembering a formula? Yes. So I find this easier. But if the formula works for you, I will not dock you on your homework. As long as you show your work, I don't care how you do it. If you show your work and I can follow what you do, you will get credit. So if you want to do it that way with the formula, that's fine. But now I don't have to deal with that 133.3 mLs per hour divided, I don't have to do that. This does it all. 3 steps in one equation with dimensional analysis, okay? But here's the part that we remember, we have to ask so one was, there was 3 parts to it. One was, what's my drops per minute? We got it. What's my percent change? 33 minus 21. This doesn't change no matter what.
Minus 21.
So 33 minus 21 is 15? No. They have a 9 in there. What's 33 minus 21? 12?
12.
12 divided by 21 is, I have a calculator in my hand, I'm asking.
57%.
Okay.
It didn't ask that. That was pretty much one of the ones that I had on the homework, but it didn't ask for the percent change.
Right. Okay.
What is the course of action?
That's what I'm actually looking for.
That one.
Increase the,
You will increase your rate to 38. You just make sure.
It's got the answer.
Yeah.
it's gonna increase it to 33.
Oh, I see what it's saying. That slide said anything over a 25% change, you need to get a new order. That is based on facility though, so that's why I didn't pay any attention to it. Every facility is gonna have something different. But rule of thumb is if I have to make a 25% change in either direction, I need to call the doctor. Okay? So is this greater than 25%?
Yes.
Yes.
So my course of action for C is call the doctor for a new order.
So that's what we would put.
Call the doctor. Because I'm making bigger than a 25% change. Call the doctor. If it was, let's say if it was a 24.9% change,
Just put nothing?
you would just say, I would increase the rate 24.9% to this new drop rate. That's all it would be.
To the 33 drops per minute, okay.
Does that make sense?
Mm-hmm.
We'll do another one. So let's say I was in a helicopter. We were talking about that amiodarone. 150 milligrams of 100 mLs over 10 minutes. 15 drops per ml is my GTT factor. What is my GTT per? So what do I want to do?
200 mLs over 10.
I'm going to do this with dimensional analysis. 100 mLs over 10 minutes. So what do I want at the bottom based on this right here? Minutes. So do I need to do any conversions for this? No, I'm already in minutes.
So then we put 15.
So what has drops and mLs in it? Because I want drops on top, right?
15.
The 15.
So I have 15 GTT per 1 ml. Cross those out. What's on the bottom? Minutes. Good. What's on the top? Drops. So since my rate here matches, I have drops on the top and minutes on the bottom. I know I set it up right? 100 times 15
150.
divided by 10. So 1500 divided by 10.
150.
Right? Let's do another one. We'll do two more. I have order for NS 500 mLs over 0.5 hour. So do I need to convert that to minutes? I could.
It's already, it's basically 30 minutes
It's
already.
basically 30 minutes. So I could do it fit 500 over 30, or I could use dimensional analysis to do the conversion too. So dimensional analysis, I would do this. Over 0.5 hours, 10 drops per ml, and 1 hour for 60 minutes. I put it that way because I want to do this. So my unit left is drops per minute, right? 500 times 10 divided by 0.5 divided by 60.
67 drops per minute.
Is that it?
500 times 10 divided by 0.5 divided by 60. 166.6, so yes, 167 drops per minute.
Uno más. Okay? Any questions so far?
No. Do a percentage one,
Another percentage one?
please.
Okay. I'm supposed to run 2 liters over 15 hours. GTT factor is we'll do 10. And I'm making this up, so this might be whack. But we'll try it. 15 hours, 10 hours. I have 750 mLs left. Hope that does the math right. New GTT factor and percentage. All right, so let's do this. So what's my new way? What do I? How much time do I have left?
10 hours.
5 hours.
5 hours, because I had 10 hours I checked.
Sorry.
5 hours left. Well, how much mLs left?
750.
50 mLs.
150.
10 mLs. Hours. We drops per minute.
That is a 250%
750
chance, or 2
times 10 divided by 5 divided by 60 equals 25 GTT per minute. Okay, which is my new rate.
Yes.
Hold on a second here.
Where'd you get the 5 hours?
Because
That's how many
at 10 hours I checked. So if I had it over 15 hours, that leaves me with 5 hours to infuse 750 mLs to get it back on schedule. Okay, that's my new rate, 25 drops per minute. But wait a second, what do I not have? I don't have the original rate, right? So I have to have the original rate to do the math. So 2 liters over 15 hours times 10 GTT per ml times 1 liter equals 1,000 mLs, right? Because this is in liters. Times, so where are we at? 1 hour is 60 minutes. So make sure it all crosses out. Liters, mLs, hours. So what's left?
GTT.
Drops per minute. So we know we did it right because it's set up right. 2 times. That's the cool thing about dimensional analysis. If I set it up right, my right unit will be there. 15 divided by 60. 22.2 or 22 GTT per minute.
That's
my old rate, right?
That's not a ridiculous increase though.
So, I was pretty close. So new, 25 minus old, 22 over old, 22 equals 3 over 22 equals
13%.
3 divided by 22 equals,
14%.
yep, 0.136 or 14%. 14% increase is what I had to do. Okay?
That was actually pretty close.
Pretty dang close. Thank goodness it didn't. I was worried it would come up to the exact number. So, because I just made that up on the go. So that may help you make a little bit of sense of this.
Yes.
If you have any questions, come see me. Okay? If you have any questions, go see the tutor. Either or. We are both, all of us are glad to help you. Okay, you guys have a good one.